In less than 50 years, Singapore transformed itself from a developing country to a thriving global economy. With people as Singapore's most valuable resource, its leadership recognized early on that developing its science and technology capabilities will not only deliver health, but also wealth. Singapore's quest to be a medical innovation and enterprise hub has been relentless. The country's latest roadmap for technology and science development includes a record $14 billion. The goal is simple: research, innovate, and commercialize. Singapore's National Eye Centre has been at the cutting edge of the Lion State's strategy to turn its researchers into global entrepreneurs. Its medical director received more than $180,000 from the National Health Innovation Centre to develop a tool that detects diabetic complications affecting the eyes. Called Selena, it has been adopted in Singapore and distributed across Europe and Asia Pacific since March this year.
As a clinician, I really have no idea how to commercialize our research. So NHIC helped us by firstly looking at market feasibility, a business plan, and gave us project managers to move a research product into much more later stage commercialization. So for example, Selena is now licensed to a major MNC, which will take the product globally in different markets.
Singapore is pushing hard to strengthen innovation and enterprise in the country's healthcare community. The NHIC, a government-supported agency, provides clinical researchers with translational funding to boost the healthcare sector. The agency's executive director says for Singapore's economy to thrive, innovators have to become part of the country's economic system.
We are identifying key projects which have, number one, commercial value, has relevant, important changes that can be improving on healthcare adoption, making things more faster, more efficient, cheaper. This is the way healthcare is going now.
So what are the different roles NHIC is fulfilling?
Our national mandate is to really make sure Singapore is up there in terms of innovation on the global platform for innovation. And obviously we want to have an economic benefit to the country, and innovation will always bring in new jobs, create new ideas on thinking, create new policies, new protocols, and bring in the expertise and talent necessary. So I think innovation and economy building comes in hand in hand.
The NHIC receives about 60 applicants every year. 70% are for tech-related innovations. The rest are in the biopharma space. Competition for the funding is stiff. The agency carefully selects projects for the global market. The clinicians applying for the agency's help have to meet 3 important criteria.
One is a validated clinical unmet needs. Second thing here is that it has to be a sizable, addressable market. And the third one, it has to be a passionate and dedicated project team that will help you to see through the whole entire project. Once it has been funded by NHIC, we will have project managers to guide the clinicians to develop this project. We will look into things like regulatory for them, reimbursement, and we will even also look into the business model of the projects that they wanted to develop through commercialization.
Thanks to medical advances and a highly accessible healthcare system, Singaporeans are living longer lives, in fact the 3rd longest in the world. But the island also has a very low birth rate and one of the most rapidly aging populations in Asia. Heart diseases are on the rise, so implant technology may just be the answer to meet the growing demand for heart care. Professor Theo Kofidis and his team received around $1 million to develop a human-like heart valve. The so-called Sing valve's first prototype is expected to hit the markets in 2023.
Our valve is not off the shelf. We are taking the patient's pre-operative data. As usual, nothing, no special scan or anything like that. As the usual pre-operative scans we do in every patient, and we measure, use a special algorithm developed in our lab to then produce a valve that is personalized, is individualized for the recipient. The valve is then produced within the time of 2 days, sterilized, packaged, and sent to the hospital where the operation is to be carried out.
Personalised or not, it's clear the public sector will continue to play a critical role in Singapore's innovation success story. As for the future, the NHIC has big ambitions.
I want NHIC to be a household name, the go-to name, not just in Singapore, but in Asia and beyond.